So hey everybody, as one of the comment which I have seen, you guys have mentioned that you need post-operative care of a child and family in the hospitalization. So we can start with the post-operative care after the operation. That is, nursing responsibility in the post-operative care of child and family includes meeting both physical and psychological needs of a child, and operation bed and necessary articles to be kept recorded and ready for receiving the child, and to provide immediate post anesthetic care in the recovery room or in the pediatric unit. So first we will see what is immediate post operative care, that is, receive the child with detailed information about the operation preferred and the case sheet to be recorded accurately, and check the vital signs and give O2 therapy if needed, and maintain patient airway by placing the child and side of the abdomen to allow secretion to drain out and to prevent tongue from obstruction pharynx. So these all are the immediate care which we will give. So first we have seen that all the necessary information about the operation, we are supposed to record it in the case sheet, and next we are supposed to check the vital signs and give O2 therapy if needed, and then we will see if the patient airway is clear, and also we will place the child in sideline position, okay, to rule out all the secretions, so that no aspiration will be taking place and no obstruction is there in the pharynx. So next point is suction any secretions if present. So if ruling out is not working, then we will be doing suctioning. We will suction any the secretion which is present, then restrain the child to prevent dislodging of the IV canal and drainage tube and dressing. So restrain we will use for preventing any dislodgement from IV cannula or an IV drainage tube and dressing, etc. Okay, then we will see monitoring and recording of the vital signs: BP, bleeding, vomiting, diarrhea, signs of any shock, level of consciousness, restlessness, skin color, cyanosis, pallor, and other complications if present. And also we will check the nasogastric tube. If any secretions are present, we will suction it, okay, and we will aspirate the content, and also the interval and the amount we will record. Next we have administering of prescribed medications, like post anesthetic or post operative medications which is given. We are supposed to administer it, and also we are supposed to record it in the case sheet. Then we have monitor IV infusion flow rate as directed, and check for any drainage tube and connect with the bottle or the bag for continuous drainage, and give the child or children nothing per mouth, that is nil per oral. We are not supposed to give anything by mouth until the effect of anesthesia is released, because since the anesthesia is effective here after the post-operative period, the child is high risk of aspiration, okay. Whatever given, if we are giving by mouth, the child may aspirate it because of lack of muscle control, right? So we are not supposed to give anything by mouth, so we will keep the child nil per oral till the complete awaken from the anesthesia occur, and begin feeding with sips of water when directed. Then next is maintain intake and output chart accurately. This is commonly we will do. And then explain the parent about the treatment plan. Also we will explain the parent what is the further treatment plan. Then maintain warmth and cleanliness. And moving towards the B section, that is care after recovery from anesthesia. First we have seen immediately done post-operative care, okay, immediate post-operative care we have seen. Then we will see what is the care after recovery from anesthesia. So here I am including all physical as well as psychological care, okay, in this only. So first is continue to make frequent observation in regard to vital signs, behavior, and hydration. So we will continuously monitor what is vital sign, rehydration, and everything. And then also urination pattern, dressing, operative site, drainage, bowel sound, passage of flatus, and crying and pain, or any other signs of complication if it is present after post operation, okay. Then change in the position frequently is done to minimize discomfort and complication. Obviously if after the child is bedridden, continuous position changing is done for good circulation, and also to prevent bed sores and any complications if it is present. We are supposed to keep the patient in comfortable position for fast recovery. Okay, so next is administer prescribed medications with precautions and record the effects. So along with the precaution, we are supposed to not only administer the prescribed medication, we are also supposed to see the side effects if it is present. If the medication is effective, that also we are supposed to inform the physician, and any complication we are supposed to inform the physician. Then continuous IV infusion and nasogastric aspiration or other drainage is required if it is present, if NG tube is present. Then also provide diet as prescribed. Then maintain adequate rest period and sleep, and allow early ambulation and self-care as possible. Ambulation is like movement and exercise of to maintain proper range of motion. Okay, and also the self-care is encouraged for the patient. Then prevent infection by hand washing, aseptic measures, appropriate wound care and change of dressing, breathing and coughing exercises, etc. And provide good general hygiene with special emphasis on mouth care, skin care, and care of bladder and bowel. Obviously, mouth care, skin care, and care of bladder and bowel are more prone area to get infections, since we are using nasogastric tubes, and also skincare, since the patient is not moving after the surgery. The surgical portion skincare is very mandatory, and also the care of bladder and bowel. So next is to follow preventive measures for post-operative complications like shock, hypoxia, hemorrhage, wound infection, abdominal distensions, and urinary retention, embolism, emotional stress, etc. are to be monitored, and provide emotional support, reassurance, recreation, and diversion. All these therapies can be provided for fast psychological recovery. Okay, then plan for removal of stitches. Usually stitches are removed by 5 to 7 days, and prepare for drainage from discharge from hospital. Then teach the parents as well as child regarding the continuous care of child at home, and rest, diet, and medication. All those health education can be given to the child. So that was all about post-operative care which we are giving to a hospitalized child in pediatric sector. In a simple word, I have explained. So thank you so much. That was all about this video. Thank you.